Hello everyone, I'm Dr. Aparna, Fertility Consultant, GarbhaGudi IVF Center, Kalyan, Nagar. Today let's discuss about what you should expect on your first consultation with your fertility consultant. When the couple they come for the fertility consultation in your first visit, we usually register you, take your details, take your identity proofs, and we make a combined file of the couple as a husband and the wife. This is a mandatory for any fertility checkup at any fertility center. So after all this, initially they check your height, weight, and what is your body mass index, that is the BMI. So with this, after checking for your vitals, how is your blood pressure, how is your pulse rate, everything, the fertility nurse staff, they will ask you to meet the fertility consultant. So with your fertility consultant, initially there will be a history taken in detail with both the female factor and the male factor. So what are all the history we collect? Initially we go with your age, how is your periods, after the age, what is the married life? In the married life, is it a consanguineous, that are you married within the relation, within the relatives or within the family relatives or not? And how is the female partner's menstrual cycle? Is it regular, irregular, painful, not painful? If she has heavy menstrual bleeding, is there any significant past medical history like anemia, diabetes, hypothyroidism or any kind of thyroid disorders, hypertension, or previously any significant surgical history for any reason, and elaborated medical history. Along with this, we will be taking any history of tuberculosis in the family or themselves were affected with the tuberculosis. In the family history, any twin conception, cancer issues, or any other significant history like infertility, recurrent pregnancy loss in the family, they want to share with us. Yes, all these are very important for us to tailor your treatment protocol. So similarly, how we are taking the female partner history, the male partner history is also equally important. The age of the male partner and previously any investigations if they have done, we'll elaborately see what are all the test results were there and evaluate and tailor the treatment protocol. And coming to their lifestyle, how is their habits like alcohol, smoking intake or any substance abuse. All these are important for us. So be prepared yourself to give us the complete history. Along with this, the coital history, how is the frequency of the intercourse, is there any difficulty in sexual activity, and are they aware of the fertile period, how long they are trying for the pregnancy, and what are all the treatment approaches they have taken before. So have they taken any ovulation induction, have they taken any IUI cycles done, or if IVF cycles are done, what were the details, why there was a failure in the previous cycle, how can we change our treatment in this present cycle. So we have to evaluate their history in detail. So in your first consultation, you have to take little more time for yourself, and you have to give the fertility consultant also the time to evaluate your history in detail. So once we evaluate your history in detail, we summarize your case that okay, this is the method of evaluation next I have to do. So then for the female partner, there will be a transvaginal scan where we analyze how the uterus size and shape is. Then the position of the uterus, is there any abnormalities in the uterus, how the inside lining of the uterus is, and how the ovaries are placed, and what is the ovarian size, what is number of follicles we can see in the ovaries. Do we see any other abnormality in the pelvis also we identify. Similarly, for the male partner, there will be a basic semen analysis testing. If there is a previous history of failure, we also advise advanced semen analysis for the male partner. So after this thorough evaluation, we tailor the treatment in their coming visits. So please be patient in your first visit if it is taking time. Yes, it takes time in your first visit mainly to help you to ease your treatment. Thank you.